Take you to this story. Keeping your eye healthy in check could be the only solution to ending preventable blindness and vision impairment. Today marks World Optometry Day, and to talk more about the importance and all that we can do to try and take care of our eyes, I'm joined by Nivien Subramany. She is the president of the South African Optometric Association. Thank you very much, Doc, for your time here on eNCA. Just firstly, how bad is the situation, particularly in South Africa, in terms of people who, go blind when they could have prevented it?
Good afternoon to you, Maseko, and to your listeners. If I would hazard a guess, it would be about 80%. And that is basically only because there is a lack of education, affordability, and accessibility to affordable eye care.
And that's where I was coming, in terms of affordability. You go to an optometrist and the glasses alone will cost you about 800 Rand and above. For the cheapest, probably you'll be charged about 600-800 Rand. And then you still have to do the eye test. And sometimes they'll even send you to the doctor to go remove something in your eye. So, in terms of the fact that South Africa is a country where it's a low percentage of people who can afford healthcare anyway, what do we do?
Well, my advice is to go see your optometrist. There's always packages available. There's the eye health system that is available at the public departments of health, at your hospitals, at your local hospitals. Obviously, there is an increase of the influx of people coming in to have their eyes checked, but they never turned away at these institutes. They may have to wait a little longer, but they will be definitely seen to.
What about small children? How bad is it on that front?
And I'm glad you actually asked that question, because kids are dear to my heart. Let's just start at the beginning. A child should actually be tested at 6 months of age, then 3 years, then 5 years. And every year, depending on the optometrist and what they actually advise. So basically, kids are prone to very high levels of myopia, let's just say that, because obviously things have changed. We're using devices. You're a lot more indoors. And I would actually advise parents to change your environmental status. Let kids spend a lot more time outdoors, away from devices, maybe riding their bicycles, doing things that we used to do before technology was introduced, just to get the health of the eye examined regularly as well.
All right. I don't think I was tested at 6 months and then 3 months, etc. So what's your message to parents in that instance? Because they're probably thinking, I've got a lot to worry about when it comes to this child. I have to find them the right school, make sure they are clothed. And we're a country already where people are going through tremendous stress.
Your eyes are the windows to the world, and it's not only vision that we actually test. So we test the health of the eyes, and it's you can pick up a lot of diseases very early if you have your children's eyes tested at an early age. Myopia is on the rise. We've got kids that you could be born with glaucoma. We could have kids that are born with cataracts. And because kids have no reference point in terms of vision like adults do, they don't often complain. And it could go unnoticed until they're at school, where they're sitting in a class and they can't really see the board. And it's sometimes too late by then, because your plastic period for your eyes is between the age of birth and 7 years. And if you don't catch it early enough, it's a little bit more difficult to actually treat these conditions.
All right. Thank you very much for speaking to us, Nivien Subramany. She's from the South African Optometric Association, and she's the president of the association. All right.